thank you for that introduction. I think after this talk, we'll see which one of us is the smart one, and it won't be me. We're going to tag team. I'm going to talk for a little while, and then Matt will talk, and then I'll come back later. But we'll be talking about our mobile-based asthma action plan that we developed. The reason that we developed this application is because all patients with asthma are theoretically supposed to have an asthma action plan. And basically an asthma action plan is a paper document, historically has been a paper document that is given to the patient for instructions on their daily medications as well as what they should do if they have acute symptoms. So if they start to have shortness of breath, coughing, or any other asthma symptoms, they can refer to the asthma action plan to find out what types of treatment they need to do, or if they need to call their primary care doctor or go to an emergency health clinic or emergency room. So traditional asthma action plans have been on papers. These are just two examples. They usually have a red, yellow, and green zone that correlate with severe, moderate, and then no symptoms. We wanted to target teenagers because they're a high-risk asthma group. And as you can imagine, most teenagers do not walk around with a piece of paper with instructions on what to do when they have an asthma emergency. So we developed a mobile-based asthma action plan. We called it PEAK, or Pediatric Education and Asthma Knowledge was the acronym that we used for this particular study. And we wanted to examine the feasibility of using an asthma action plan that was targeted specifically for teenagers. We measured a number of things, including the usage of the app as well as some outcomes that we'll talk about later in terms of asthma control and asthma self-efficacy for the children with asthma. The MD portal, which Matt will probably talk a little bit more in depth about, is where we put in the information regarding the rescue medications and controller medications that the child is supposed to take, as well as their emergency asthma action plan and any alerts that we wanted to receive. So if the child inputted data that suggested they were having a severe asthma attack, we wanted to be alerted to that. The enrolled children used the application for 8 weeks, and the parents did have access to a web portal where they could go in and look at their child's information. Whatever the child put into the app was on a parent web portal for their view. And then, of course, the children were able to do their input their data from their phone, and this was application was compatible with iPhone and Android phones. And so Matt's going to talk to you about the technical side of it, and I'll be back to tell you our clinical outcomes.
Okay, so for the enrollment portion, the provider, or Dr. Perry, and the others at the clinic on the team would enter all of the action plan data from the sheet of paper into our web portal, and it would generate a QR code that would tie the provider with the account on the phone. So they would scan the QR code on the phone and then log in. And once they logged in, they'd have access to all of their information. This is, we kind of took the interface design and wanted to model it slightly after that of the Facebook app, if any of you have used the Facebook app. We did that on purpose because the target population is probably on Facebook. That's probably the app that they use the most on their phone. And so we did the slide-out navigation with the different options where they could access their peak zones, they could access their asthma medications, and they could also input their peak flow on a daily basis. And they would have options to input that peak flow. And they could do so by either entering the number or entering symptoms off of a list, and that list would then correlate with a list, what symptoms that go along with a certain zone, the green, yellow, or red zone. This is an example of the UI that we used for the peak flow input. And so the user just had to scroll up and down. It was really quick and simple. The patients would be notified on a daily basis to enter their peak flow, and most of them did it I think 4 to 5 times a week, which is really good for people to use apps, because most apps on iPhones are used once or twice, and then they sit on your home screen or get deleted. And so to be able to keep having users use the app is a really big deal, especially for mHealth apps, trying to keep the patients to use the application. And so the notifications that we would send every morning at 8 a.m. to remind them to do their peak flow, and if they hadn't done it by 8 p.m., it would also send them a reminder to enter that data, and also to log whether they took their medication. So this is an example of the home screen on the phone. It just shows their current level, some asthma tips, and basic information. Once they enter their peak flow, it would take them to their zone. If it was red zone, it would pop up with red and give them steps to either call their physician or call 911 if it's bad enough after 20 minutes, and so on. And if they entered symptoms that are certain symptoms that require emergency attention, it would notify them of that as well. Okay. Here's an example of the MD portal where the providers could go in and see the data. It shows their current peak flow level, the medications that they've logged ever since they started using the app, as well as the daily range of the high to the low, and it shows all the peak levels throughout that day, as well as the symptoms logged. And so if a patient logged a yellow or a red zone, the office would be notified to contact that patient within 2 hours, and then if they got better, no further action would be required. And this is where they would come to check that information once they got that email. I think that's all for my part.
Okay, so of course, the purpose of the mobile action plan was we had multiple purposes. One was to provide education and medication reminders for our children or teenagers with asthma, because oftentimes when you're in an office visit, it's very difficult to get everything in one visit. And then, as you guys know, it's really crucial, especially for teenagers, to be reminded, because they are still children, to be reminded to take their medications. And then the app also helped the child to become more independent, because they could then self-manage their asthma better. And it eliminated the need for them to have a paper document to refer to when they had symptoms, or if they just wanted to go over their regular daily medications. And then another purpose of this application was to provide both the parents and providers with information in real time, because I know when I see patients in my clinic, they'll tell me, oh yeah, my asthma is fine, but they may have forgotten what happened a month ago or 3 months ago. So with this application, you can go back and look over time at how often they're logging rescue medications, or logging that they're having red zone days or yellow zone days, which would be a red flag to me that they may need to be on additional medications. So for the pilot study that we're presenting today, we had 20 children who were enrolled in this study. The mean age was 13 and a half years. We had a 50-50 split with boys versus girls, and we had a very small Hispanic or Latino population, but otherwise was relatively diverse and probably pretty consistent with what we see at Children's Hospital and asthma clinics. I want to go into more detail about the demographics. Just to get right to the meat of the story, the children took a pre and post asthma control test, which is a very quick clinical tool that we use to assess asthma control. And if you look at the first set of bars, you look at the total study group, there was not a significant change in asthma control test score. However, when you looked at patients who had uncontrolled asthma at baseline, we were able to show a significant improvement in their asthma control score after just 8 weeks, which is really impressive because, we didn't really anticipate that children that already had well-controlled asthma would have an improvement in their asthma control test score. So we were really wanting to make a difference in the kids who had uncontrolled asthma to see if just this application without any additional medications added to their regimen could have improvements. We could show some improvements in outcomes. So we were able to do that. And then we were also, this is kind of a jumbly slide, but it looks at self-efficacy, which is the child's ability to monitor and manage their asthma attacks or their feelings towards their ability to control their asthma. And we saw in overall attack prevention significant improvement. So the children felt like they were better able to prevent themselves from having an asthma attack. And I think some of that was from the asthma education and just the empowerment of being able to log their own medications and keep track of what they were doing to try to control their asthma symptoms. So as Matt alluded to, the teenagers use the application for a mean of 4 days per week during the study period, which is excellent because I know for a fact that most teenagers do not look at their paper action plan 4 times a week. And we were able to show improvements in asthma control test scores as well as self-efficacy after 8 weeks. We are in the process of pursuing additional funding so that we can have more patients enrolled in a similar study using an asthma action plan. We want to try to get some input from teenagers so we can make this more fun for them and get input from people who are a little bit younger than Matt. Just because they can probably give us some useful information about what would make them stay engaged with the application. And then, of course, we want to continue to expand our web portal for parents and providers. So that's all I have. Thank you.